like a general population, like someone who's jogging, that it is important to be a little bit more on the heels, or at least more on the midfoot rather than running on the toes. I don't know. What do you believe with that?
We are live. Hello, anyone. I'm Joshua Royland, a strength and conditioning specialist and owner of Sweatshirt Fit. Our guest today is Greg Diem, a recent physical therapy graduate from the prestigious Quinnipiac University. Today we will be discussing your journey into physical culture and exercise, your educational experience, and your recommendations for young athletes and general population in relation to injury prevention. How are you doing today, Greg?
Doing well, man. Thanks for having me. How are you?
Doing all right. First of all, are there any secrets to injury prevention, just to get off the bat?
Like a secret generally for everything?
Yeah, just
It's
everything.
a little vague,
Yeah.
but in general, a healthy lifestyle, a healthy diet. I always encourage people to do more activity rather than sitting on a couch watching TV all day. In general, more activity is going to help lead to a healthier lifestyle, working out, going on walks every day, going to the gym, and also, putting the right fuel in your body, because what food is really energy, a fuel for your day. So trying to do your best with having a healthy lifestyle.
That's always seemed to be something that I try to encourage in people, is the overall healthy lifestyle. And ultimately, for athletes specifically, that seems to be a general population kind of deal, which is just increase your activity, because overall our population is like very far out of the realm of health. They just have to get out and walk, get up from the couch.
Definitely.
No cheesy poofs. But I mean, so let's go into the athletes really quickly. What's like the most general injury you would see in an athlete? And let's just say any athlete.
So if I want to talk more about like the older population athlete, like the weekend warrior, you see a lot of like hamstring strains and things along that nature, like calf strain tendinopathy type of issue, because you're seeing people that are kind of going from that 0 to 100. They're sitting down at a desk job 40 hours a week, and then on the weekends they want to run and play tennis. So that's like your general athlete, more out of shape. They're not keeping up with their stretching. They're not always putting the best fuel in their body. But if we're talking like a high school athlete, it could be really a wide variety, because you're seeing a lot of different sports, a lot of contact sports. I'd say you definitely see more variety with that population. So it's hard to really say one thing.
Okay. Let's go into some of the stuff that I discussed with one of my previous guests, Chad, also one of our best friends. He was talking piriformis tightness, where this would be general running issues.
Yep.
in general. He suffered piriformis injury, piriformis tightness, and he had to work his way through that. And he ended up getting a Haglund's deformity, resulting in bursitis in both his heel and his knee. Rough, multiple injuries throughout his college career, recovering and then not recovering, and being mishandled in ways that I think. How would you handle such a complex issue? So say a kid comes into you with piriformis tightness. Is that something that could eventually result in all of those other issues if mishandled?
Well, a lot of times what I see is people who have piriformis tightness, it's really secondary to almost like an underlying back injury, where that piriformis muscle will be taking on a lot of the load, or it could also additionally be because the back's in a off alignment because of pain or injury, that piriformis is going to be misaligned and tighter than it normally would be on that side of back injury.
Okay.
It's very common to see. So a lot of times releasing the piriformis tightness can help to bring the lumbar spine into a better posture and decrease pain. But in someone like Chad's case, it seems like it's a different scenario where he had a lot going on at once. But I would treat, if he walked into my clinic, I would treat all the different findings I'm seeing. He probably would come in with an ankle diagnosis, or you said he had like a hallux.
Well, the issue is he initially had a piriformis issue early on,
and then it led to.
Well, I don't know if it led to.
You don't know what
my
led
question
to what?
is more. Yeah, it's just a whole shit show. And again, I think that his athletic trainers in Manhattan College just pushed too much volume too quickly.
Yeah.
Ultimately, that's common. He ended up having piriformis injury of some sort. Might have been tightness, might have been whatever, he doesn't know. But can that result in down chain issues? Because from what it seems that your lumbar spine, from what you say, can result in hip mechanic issues.
Absolutely. And then that can travel all the way down the chain, or it can come vice versa. It could be something off at his foot could lead to problems above. It can go both ways with the whole lower extremity chain. But my point being, if somebody like that walked into my clinic, I want to take a look at the whole, we call it a lower quarter screen, not just looking at the foot. We'll do the whole leg, even at the back too. I see a lot of times people coming in for an ankle, but really the issue could be at their hip, right? So that's why I like to go through that whole screen to kind of get an idea of what type of exercises with treatment would be best for that patient. So.
Okay, so you were talking about how it can be the entire lower chain. He seemed to have one of his feet off, where one would land fully, one would land like this. And he talked about how running mechanics being taught earlier in the career might be something that's important to deal with in athletics, and it's kind of ignored because they seemed to talk to him about running mechanics but not address it as much as they needed to. The first thing I would have done if he came in with piriformis issues, I would have automatically given him not just stretches, but hey, let's look at your mechanics. So get him on something to run, and then, okay, your volume's too much. Your foot is striking wrong. And really just dealt with the technique issues rather than, it seemed like they sent him in, they'd release the piriformis tightness, throw him out the door, and then get him back into regular.
Yeah, and you mentioned he had, was it a knee problem as well?
Yeah, he ended up getting bursitis in his knee and in his heel.
Yeah, so I think you're definitely right in the fact that he was repeatedly striking his foot in almost like a supinated way where he was really hitting the outside hard, and that was causing issue, not just at piriformis, but also ended up costing him his knee too, because maybe he was in too much valgus or something, and I don't know exactly what it was. It was some sort of issue at the knee came up because of the misalignment at the foot. So they really didn't solve the main source of his problem by just stretching his piriformis, like you said.
From what I remember, he was a heavy heel striker in high school.
Yeah.
And ultimately that wasn't corrected.
Yeah, whatever it was, I don't know all the details, but it sounds like they didn't really go finding the root of the problem, and that's what ended up costing him a lot of his college career that way.
Well, he performed well, and let's get more into your career, because I was just interested in that as a aside to start up and talk about some of that stuff. But let's go more into what you do. You are a hockey player. You were cross country, track and field. Got a lot of athletics in your past. You went to college, university, undergrad, doctoral. You had your exams. We're going to talk about knowledge base versus practical application. Basically, I'm going to start from here. How did you get into exercise, sports? What did that journey look like?
Oh yeah, from a young age, I played a lot of sports. Hockey growing up, I still play hockey. I played baseball, soccer as a kid for a little bit. And then into middle school, I got really into running. I did cross-country track up until senior year of high school. Yeah, right now I really just play hockey 1 or 2 times a week. Obviously, I'm a physical therapist right now, so I get to treat and see a lot of different athletes that come in the door, which is an awesome experience. I really got into physical therapy in high school, just knowing I love sports, and I didn't really know what I wanted to do going into school, so I observed a couple clinics, both an outpatient facility where I work now, same type of setting that I work in now, and also a inpatient rehab, to get different senses of what the scope of physical therapy can do. So
okay, so I guess from here, before you were even a physical therapist, what sort of injuries did you deal with, and how did you deal with them? The people around you, what were they saying?
Totally different. I was pretty fortunate myself with injuries, nothing too major. In hockey, I had a slight back injury one season that I kind of just played with, but it wasn't anything too severe at the time. At the time, I wasn't really educated on even what it could be. I just played through it. And then I had a wrist injury in high school where now knowing more, I think I had a slight fracture of my scaphoid bone in the hand, but I didn't really know at the time what it was. And I just kind of, after a few weeks of wearing a brace, played through it with baseball.
I think I remember you having that issue.
Yeah.
I think I remember you.
But luckily, nothing too major. Those kind of both resolved within a month or two. Never had to go to PT myself, which people find interesting because a lot of physical therapists actually get into it from being former patients too, which is interesting.
That's kind of funny because I have gotten lots of injuries. I have major issues all over my body, but I've never been in physical therapy. So,
and you probably would have been appropriate in many of those cases, but you
still
chose
probably appropriate. Yeah. But it's just how some people go. Let's say injuries you'd see in hockey Let's go there really quickly, overview, and then what people can do to avoid that. Because I want to hit the three major sports you really did, which would be hockey.
Sure. I mean, obviously, hockey is a contact sport. I don't play contact right now in men's league, so it's a little more relaxed. But you see, growing up, a lot of people can get hit, can get concussions from repeated hits. I've heard a lot of stories about repeated concussions. You have to be careful about knowing what the signs of a concussion are and knowing when to take yourself out of a game or have a trainer or a coach know when to take somebody out of the game. It's really important to avoid, especially successive concussions that can be very dangerous. So first and foremost, I would say that's the most important injury to be aware of in hockey. Besides that, it could be pretty all over the place. I've seen people have collarbone fractures, injuries from blocking a shot anywhere in the body. A teammate break their fibula one time going into the boards. It could really be the contact sport. It's hard to say like one injury is the most common.
Okay, so that's really just a overall strengthen up yourself.
Yeah, you want to be in shape. Weightlifting, general strength can help. And overall, hockey is honestly a pretty safe sport. You don't see as many injuries as you do with football. I think a lot of that's because the smooth surface on the ice. You don't get those people getting caught in like the turf and leading to like the ACL and that type of deal. Ankle sprains, not as common in hockey.
You also got the ice skate kind of supporting the ankles and everything.
Yeah, it's a little easier on the joints too, skating as opposed to running and cutting as you would see with football. Or even in basketball, you see a lot of people get ankle sprains and injuries because they're jumping and landing.
Yeah.
Those high ankle sprains are pretty common. But yeah, I mean, hockey is mostly you get those contact injuries, concussion being probably first and foremost most important.
That's interesting. And then I'm actually quite surprised that there's not like a ton of knee stuff from hockey from the lateral forces. I would expect a lot more.
Non-contact, really rare. You do see those contact injuries once in a while, especially it's really dangerous. There's a penalty called kneeing. They're trying to take that out of the game completely where someone would stick their knee out to somebody. That's very dangerous with a contact sport like that.
Okay.
But again, I luckily haven't seen too many myself.
All right. So let's go just running sports in general, like cross country and track. There's a lot of things like someone like me, if I were training an athlete, I'd be looking for foot, ankle, knee, hip, back, just because that's the chain I'd be looking at. I'd be looking at, how the fascial slings are functioning. So are they able to properly extend their femur behind their actual hips properly? Do they have the flexibility in their hip flexors? Are they actually properly, because so many people think that your hips should be moving like this. You actually need a slight rotation to your hips when you're actually moving in order to get proper mechanics. So I'd be looking at a lot of different things when I'm looking at a recording of someone's running on a treadmill. What would you say is really predominant, and go from like the list of highest importance to lowest importance on what you have to look for?
Yeah, so I liked how you were talking about looking at someone running on a treadmill. That's something that I've seen in the clinic that we've done before with our runners that have come in, and it's important we've slowed it down into slow motion before. I like to look at everything. It can give you a lot of information looking at how they're hitting the ground. Are they getting a heel strike? Are they overly supinated? Or are they overly pronated? You want to see, they're getting that nice heel to toe. Looking at the hips can give you a lot of information, like you said. Are they getting full extension on initial contact? Are they getting a nice swing, enough hip flexion, enough knee flexion when they're running? How's you can look at their cadence, their stride length. There's a lot of information that you can get from running. I wouldn't say there's one particular scenario for every situation. You should listen to the patient, listen to their complaints, and you can gather a lot of information from that, depending on patient by patient case with it.
That's what I've been getting a lot with. I talked with Brandon about hand, wrist, shoulder, elbow injury with boxing and that sort of stuff. Chad was a little more specific to his situation, and now we're going into the broad spectrum. And from what I've seen is very much so dealing one-on-one is the most important way to avoid injuries with people. And I see that in team-based environments where the programming isn't individualized, people get injured. And typically when the programming is individualized, people don't get injured. I think that that's really where sports are going to be moving, is towards individualized programming designed for the person, and you just have to be a motivated enough person to handle training your own program.
I think there's definitely something to that, especially with running too, because if you think about it, it's not really as much of a team sport. You're on a team, but it's really an individual competition. You're competing against your teammates as well.
Yeah.
So maybe, there'll be more of a move to having an individualized workout plan for every member of the team that best suits their needs, rather than just having the team all do the exact same activity. I never thought of it that way before, but definitely makes sense.
Yeah, I think that when you train an Olympic runner, are you having the entire Olympic team run intervals on the
Yeah.
same days?
Yeah.
No.
So if you treat your high school athletes as if they were, that caliber Olympic athlete, how they're being treated, maybe it would lead to better outcomes for them.
Or even just have the high school athletes go over running mechanics, have the college athletes begin individualized programming, and then as you move up into professional and Olympic athletes in general, then it just becomes more and more individualized. And that just depends upon the availability of funds and training, and ultimately that's up to situation. But I think that a lot of people have good information out there, and it's something that you can access on your own. There are so many people online giving out that information. Google Scholar's available. I have clients who've come back to me with answers to their own problems, and I tell people to research stuff and to prove me wrong and to give me a better exercise for something in their programming. And I've switched out exercises because it feels better for someone.
Yeah.
That sort of honesty is important.
Oh, 100%. I like to work with my patients in a similar way where it's, a two-way street. We're communicating with each other. I can even learn from my patients a lot of the time. And obviously, as a recent graduate, I'm, still doing my research, still learning the craft. And yeah, I think that's always important to continue to see what the latest research is out there, and try to learn something new as a professional, to always, learn a new technique that might be better for an individual that you maybe have someone you're going to see in the future. But they used to call it in school learning more tools in your toolbox, right? Having more tools in your toolbox to be able to treat more issues. So it's important to have.
Let's go into general population again. When you were talking about foot strike in running, and you were talking about rolling from heel to toe, are you a believer in heel toe running or in forefoot running, and how would that apply to general populations when they get into jogging or running?
So I don't honestly know that much about high level track cross country right now. Like I haven't been in that field for a while. So I do remember in the past that they said when you're a sprinter, you're going to be more of a toe runner, which makes sense for that sprinting. But I always thought with, like a general population, like someone who's jogging, that it is important to be a little bit more on the heel, or at least more on the midfoot rather than running on the toes. I don't know. What do you believe with that? I haven't done too much research in that.
My understanding is that this is how I teach it to everybody. I don't ever teach a straight leg heel strike. When I'm teaching running, there's always what I would call a soft knee. So it's a straight leg with this ever so slightest bend to it. So you're able to use your quad as a force acceptor rather than a straight line between your heel, your knee, and your hip. So that quad can decrease both the force on the knee and the hip. And what ends up happening is you do put a little bit extra pressure on the tendons and ligaments in the knee as you're decreasing that speed, but you're putting less pressure on the cartilage. So I find putting more pressure on the tendons and the connective tissue is more important than just focusing on using that cartilage to keep that impact.
Oh, definitely.
So
Yeah.
definitely using that as that sort of spring. And again, you have to work up to it because otherwise you're going to get, like you said, just tendonitis. You're going to get all of this inflammation. You're going to get patellofemoral symptoms and all of this sorts of pain. But if you properly create volume and allow yourself to learn that type of running, you can run heel toe. I'm a big believer in midfoot running. I'm a big believer in barefoot running. And I also can say I don't follow those. I have a neutral cushion maximalist shoe because I'm running 5 miles a week. I try to run midfoot. I end up running heel toe when I'm doing certain things, but it's usually described by me as the bottom of your foot's a bicycle wheel. Bicycle wheels don't slam, they roll. So like you said, minimizing, I like using the treadmill, and if you can hear your foot strike heavy, you're doing it wrong. If you're barely hearing your foot strike, you're doing it right, whether that is forefoot or heel toe, because you can be running forefoot and stomping your feet forward, stopping yourself.
Yeah.
You can be running forefoot and rolling off it. You can be running heel strike, stopping yourself, and you can be running heel strike, rolling.
Yeah, and that's an interesting perspective about, not being able to hear it coming down. That's showing how you're using your forces when you're running. Are you really propelling yourself forward, or are you slamming it to the ground, which could cause more injury? So that's, definitely another important factor to look at.
From the aspect of students entering physical therapy school now, what would a lot of people know entering college, standard stuff, but now you're entering a doctoral program. That's scary. That's a big step. It's not a step I've ever had to make. What is the biggest goal going into your first year, second year, third year, how you approach your exams? Let's go through all that. Like, expand on that for me.
The biggest goal, obviously, is just to pass and get through. But some advice and things that I really found helpful going through grad school. You're right. It is a big step coming from the undergraduate to the doctorate program. You're going to be working more hours a week. The undergraduate party life, it's going to have to be, not put on a pause completely, but kind of like put to the side in favor of being able to spend more time studying. It's going to be a full-time job. It really is. The amount of courses, the amount of exams that in the class, amount of lab practicals you're going to have a semester. It definitely can be overwhelming at first, but my biggest advice, first and foremost, is don't procrastinate. You have to be on top of it, make a study schedule. You should be studying for your exams weeks in advance. Your teachers are all going to give you, an outline of when the exams are, what the expectations are. Making sure you're on top of it and giving yourself adequate time to prepare is going to be really important. The number one most important thing was honestly making a group of classmates to practice your skills on, study with, making flashcards, using your classmates as a resource. I honestly don't think I would have gotten through school without good friends and good classmates to practice my skills on for the lab practicals and just bounce questions off of each other and learn, because sometimes hearing it from a colleague is almost more important than hearing it from your professor, because they can almost explain it in a way that will make sense to someone that's learning it for the first time. But using your professors, and that's my third most important, is going to be also important. They're going to have office hours. If you have any questions, you can go to their office hours and ask them. They're going to a lot of times offer extra study sessions, take advantage of that. Some programs will have older students that volunteer as graduate assistants and holding additional study classes. I've had good success going to those. So yeah, those would be my, just to recap. Number one, it's important using your classmates, making a good group to practice with. Number two, not procrastinating. And number three, using your professors.
Yeah, so basically just staying organized and using the people around you is the big idea. Yeah, because you've got the professors, you've got the people around you. Those are one side of it, and then the organization is your personal side of it. And then also you probably have some time, like you said, where again, you're not going to be able to do what you did in undergrad, but you do have to take your time away for your mental health to just enjoy.
Oh, yeah. No, I definitely had plenty of time in grad school to go to the gym, to do activities. I still played hockey up there. I, hung out on the weekends, but maybe instead of going out the whole weekend, you have to, pick and choose. First of all, when you have your exams, certain weekends might be more of a study weekend, but one day for school, one day for hanging out.
Yeah.
But yeah, it is important for your health to take breaks. And one thing that came to mind was if you're someone in undergrad who was basically like, I'm doing everything on my own, I'm going to study on my own in the computer lab 12 hours a day, I don't want to talk to anyone else, I'm just going to practice on my own. It doesn't really fly in PT. It's a very social profession where you're going to be around a lot of people. The same goes for grad school. You have to be working with others and practicing your skills with others. I haven't seen anybody be successful doing it all on their own.
Yeah, so the people who pretty much just didn't thrive were the people who didn't learn to form teams. And that seems to be a big theme in what you're telling me here. And it makes sense because humans are innately team-based. It's the only way we've gotten to where we are. And especially in the physical therapy profession, you're working, like you said, among colleagues. And you're learning from your colleagues, you're learning from every experience you have during each day. I know the amount of things that I've learned from other trainers, yes, bosses and mentors, but I think that, like you said, with people who are the people around me, I've taken that and been able to apply it a little bit better. And there's almost a certain level of respect that goes between colleagues that is a little bit different than from, you know, one tier down to another, and it becomes a little more mutual. So I would then also go into study for your exams is kind of the same for studying for your final boards, correct? It's the same idea, but just big now. It's that one major one.
Yeah, I mean, the boards was definitely unique in the fact that it was so wide and encompassing of everything that is in the scope of PT, even things that we didn't even cover in some of my courses. So it was a little different in the fact that I did have to do some education on my own and pick up some things. But the boards, the most important thing for me was just doing a ton of practice questions and not even just looking at the ones I get wrong, looking at the ones I get right, why I got it right, why did I get this wrong, and that was the most important to me. And the best way that I learned, the information I needed to end up passing the test, which I did this last October, happily. Yeah, but
Congrats on that again.
Most programs, my program did give us kind of like a simulated type of boards exam that had a wide scope of questions. So, you get a little taste of that in your graduate school as well. But I thought it was still pretty different than what the actual boards ended up being. Appreciate it, by the way.
Yeah, no, that was something we all were so proud, as a friend group of you being able to do that. It's a true accomplishment and
Thanks, man.
something that is not common. There's a lot of physical therapists, but think about how many there are in relation to the general population. So that's tough to do.
Well, for anyone who's listening to this, I'm sure you've seen your own research, but out of my PT class of about 90, I think almost everybody passed on their first try. So it's not something to be super worried about. You do have to put in the time, you have to put in the studying, but not something to get super, super stressed about. If you were able to get through the program, you'll be able to pass the test. And if not on your first try, there's multiple attempts. And yeah, I think everybody's gonna be fine eventually. I know a lot of people were freaking out in my program about it, and it ended up working all right. So
that's good as well. And I think that, having the perspective on after passing versus before passing can really give you that sort of hindsight is I did what I needed to do.
Exactly.
And now the big thing is what happens afterwards, the difference between knowledge and application in the workforce now.
Yeah, what's
the difference? How does that change? How much
for myself personally? Yeah, I definitely picked up a lot of the foundational keys. How to do a PT evaluation, different techniques, manual techniques from school, but honing them in on my clinical internships, which is part of every accredited PT program. You're going to have about 3 or 4 clinical internships at different settings, and the more you do there, the more you ask your instructor, and the more you can practice, the better prepared you'll be when you're entering the workforce. Obviously, when I entered, day one of being a PT working, there's still a lot to learn, and I was very fortunate to be at a great facility where my colleagues interested in teaching me new techniques, giving advice on different conditions they've seen before, how they would go about treating it, and I don't always have to go 100% how they would do it. I'm going to be my own therapist, but there's a lot of positives to that, seeing how somebody else who has experience goes about treating different situations, learning a lot of new tools and techniques from them. And I think most PTs I've seen have been fantastic. I'm sure most places where you would end up would have the same type of situation. If not, maybe you're not at the right place, honestly. If someone's just throwing you into the fire, there's no guidance, no assistance, nobody interested in educating a new PT, maybe it's not the right place, to be honest. But every place I've ever been at has been great in that regard.
So you've had a good experience with your internships and tours and such. My bigger question now would be, what is your recommendations for the people who are thrown into the fire? How do you deal with someone who's a bit of a tougher mentor, who's a bit of a tougher overseer.
Oh, so you're saying on your clinical internship during the PT program?
Yeah, now we're in a clinical internship in that later portion, but
Yeah.
getting ready to move into the career.
Yeah, I think always being open, asking questions with your instructor is important. If you show interest, they're gonna appreciate that and maybe show more interest in giving you more of their advice, more feedback. If you're someone who's just going through the motions and you're not really putting 100% effort in, they might pick up on that and say, you know what, let's just get this kid's 8 weeks done. We'll help them out a little bit through a few things, and that'll be it. So I think the more questions you ask your instructor, the more interest you show, the more you'll get out of your clinic.
Okay, so it just basically means staying engaged, and at this point, you should have. Some people just go through programs and don't think, but you should at least know that this is what you want to do. This is what you want to be, and if you're not at this point, I mean, you've gone way too far down the rabbit hole, and you're stuck. So if someone's in that position, guys, you've got to make the decision of, can I make myself fall back in love with this, or am I going to move into something else? Because if you do have a tough time in a career, I know that I got very far into my education thinking I was going to be a veterinarian, and I managed to, when I thought I was in too deep, pull back. Knowing yourself, being willing to take that risk is important. And I'm glad that you found the place that you are, and that you're happy with where you're at. And ultimately, that's the most important thing.
Yeah, definitely. And I'll just add that in physical therapy, there are a lot more avenues you can go in than just, what you think about, like your basic outpatient clinic or just, your hospital. There's a lot of specialties. There's, home care. There's a lot of settings that maybe you didn't even have any exposure to during your internships or your education. So, if you're not enjoying one clinical you may have, that doesn't mean that physical therapy isn't right for you. Maybe it just means, especially if you've been in the program 2 or 3 years, maybe it just means you need to look into other avenues you can travel down to find what's right for you. I wouldn't recommend just dropping it because you don't like one clinical that you might have. That'd be a mistake in my opinion. If you really truly looked at every option, you're like, there's something else that's really for me. It is the rest of your life. So I wouldn't say it's a huge mistake if you wanted to go into something else that you might really truly love. It's never going to be too late. It is the rest of your life. If you go into it, you don't want to do something you hate for your whole life. So yeah, I'll leave it at that.
So I'm going to just kind of go over what we've talked about for those students entering physical therapy school. Start off, be organized, find a group quick.
Yep.
Talk to your professors. Those are simple tips, but they're gonna make you kill it. If you're in your clinicals, ask your overseers, ask your what would it be called?
Your clinical instructor.
Clinical instructor. Ask your clinical instructor about your cases, but be your own therapist. Look into all of the avenues available, because even if you are having a tough time in one clinical, find the place that you really can call home. If maybe you're not on an inpatient, you're on an outpatient. Maybe if you're not in general population, you go into sports. Find where you need to sit for you to be happy in your career, because you can love a career and not love a career at the same time. So that's one thing.
100%. Great summary, man.
I appreciate that. I try to take those notes, and that's a really synopsis. If you are listening to one of the clips, go to the podcast just to get a little bit more of what Greg thinks on that. For those athletes looking to prevent injury and help recover properly, let's just say stretch, listen to your therapists and the coaches around you, and do you have anything else on that other than just paying attention?
With that recover properly piece, a lot of people that go to physical therapy, and maybe some clinics out there aren't as potent on this. The home exercise program is almost as important as your time in the clinic. Going in twice a week and doing that hour and a half of PT to recover from an injury there, and then going home and doing nothing isn't going to really help your rehab nearly as much as if you're somebody who did their home exercise program every day. And We do a really good job in my clinic of, from day one, providing a home exercise program of the proper stretches, strengthening exercises, functional activities that are going to be important to our patient's recovery. And we update them regularly as we progress the patient. I'm a big believer in like a slow, steady progression. You don't want to go from 0 to 100. So we're constantly, every session, adding a little bit on, keeping the challenge going to get someone properly recovered. And I'm always
Progressive overload at a proper,
exactly.
at a proper level.
And I'm always pushing. You have to be. I ask them, "Did you do your home exercise program?" Almost every time, they'll my patients, and if they say no, I'm saying, "No, it's on you. It's your body, but just letting you know, you're going to get more out of it. The more you do, the more you're going to get out of it." Yeah. And the people who have really been on it, and I could tell the people who are not BSing about it, they have shown the results. Almost all of them have really shown great results. So
yeah, I've never dealt with someone in a physical therapy sense. It's always been people, if I'm dealing with someone who's coming off an injury, it's someone who's coming out of physical therapy, I'll call their physical therapist, get some recommendations on what's contraindicated, and then work with them from there. But ultimately, the people coming in who are not in enough pain to go to physical therapy, but still need a little bit of that extra TLC, it is about that careful progressive overload. And everybody can do it from 5 to 75. You can do slow progressive overload and find what you are capable of. It's not going to be as quick for if you're older, your recovery is a little bit less. It's not going to be the same as when you're 13, as when you're 19, as when you're 90. But you can always find your capabilities, and it's never too late to start. So
definitely,
if you're in a physical therapy office and they're not providing home exercise, what would your recommendation be? Would you recommend staying with the physical therapist and just doing what they do in session, or finding a new physical therapist who's a little bit more involved in their at-home activity?
Well, if they're not giving you like an explicit like home exercise sheet, I would just ask, is this what you want me to do at home, the things that we're doing in the clinic? But if you're with a physical therapist that isn't progressing you, giving you the same 5 exercises every time you come to the clinic and not giving you any, progressions or anything to do at home, and they never do, then you probably should go to a different place. I don't think many of those places are in business or would do well, based on how everything's online. Everyone has reviews of places, they probably wouldn't have the best reviews if that's what the case would be. But, if you run into that situation, I would first ask the therapist, are you planning on giving, because maybe they just had a busy day, they forgot or something. Not to make an excuse, but maybe they just forgot to give it to you.
Well, it happens. It happens to everybody. It's happened to me once in a while where, oh man, darn it, I'm sorry, I forgot you were going on vacation. I was supposed to alter your workouts because you didn't have access to a gym. And it just happens.
Yeah, I was saying more if it's, if that's the case for weeks and they're not progressing your program and they're not giving you anything to do at home, you probably should, first of all, speak up. But if it never changes, then probably find somewhere else. Because at the end of the day, you're not obliged to go to one place. It's your body. True. You can go anywhere you want.
Well, the goal ultimately is to be your own advocate, and that's what I'm hearing from everybody as
not just with physical therapy. Healthcare, you have to be your own advocate a lot of the time. I've seen healthcare in general.
That's true, and also knowing that you can call, if you have insurance, you can call your insurance. The insurance has I believe it's like a health advocacy portion of the company, and my insurance has really helped me out with that. I got a stupid little injury that, I went to the emergency room. They charged me $20,000 for 11 stitches, and the health advocacy, they're handling it, and they said, don't deal with it. We've got this. So, reaching out to your resources, like you said, talking to your individual physical therapist, they'll give you what you need, and maybe they're not giving you at home right now because they don't believe that that's what you need currently, and just kind of trusting the experts around you. All right. Thank you very much, Greg. For anyone listening, stay happy, healthy, and safe. If you got anything left,
you're welcome. No, this was great. I think we went over a lot. We had a good summary at the end of what we talked about. So this is very informative for anybody just interested in fitness. Thanks again for having me, Josh. This was great, and I feel like this would be informative for anybody interested in PT, going to a physical therapist, going to PT school. We covered a lot of great information, so looking forward to it again.
Yep.
Appreciate it, Josh.